Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, radionuclide imaging. In cardiac radionuclide imaging, here in radionuclide imaging, myocardial perfusion imaging is done. Myocardial perfusion imaging is mainly done with the help of 201 201 thallium, or it can be done by 99 technetium systemabe. Okay, how do you do it? First, technetium 99 is injected when the patient is in rest. Okay, and then you will send the patient to a SPECT scan. What is this SPECT scan? SPECT scan is single photon emission tomography. So you will send the patient to single photon emission computer tomography scan, and then you will get the images. So these images will actually reveals if there is any defect. So thus this is mainly, it even relieves the defect, it even reveals or detects the defect even in the first few hours after development of MI. Even after first few hours after development of MI, it will reveal the defects. Okay, so the defect here is actually detected by a closed cold spot. Okay, and it is seen during the first few hours of the development of MI. So thus this myocardial perfusion imaging is extremely sensitive. But the main problem is, but the disadvantage of this technique is it cannot distinguish between two things. It cannot distinguish between the acute infarcts, whether there are acute infarcts or from the chronic scars which are present. So this is not this cannot be detected, and thus though it is extremely sensitive, it is not specific for diagnosis of MI. So how are you going to differentiate it between the scar tissue and infarcts? So infarcts and scar tissue can be detected by differentiated in radionuclide imaging by one way. So if you do a radionuclide imaging, and after doing a radionuclide imaging, if it is done first, if it is done at rest, in rest, if you see that at rest, okay, in rest, okay, if you do a radionuclide imaging both at rest and at exercise, okay, and if you see that there is decreased tracer uptake or decreased uptake of technetium 99 or thallium is seen both at rest and exercise. That means it is present both at rest and exercise. So in such cases, it is likely to be a chronic scar. Whereas if there is decreased tracer uptake is seen only at exercise, that means there is some block which is being evident during exercise. So thus it is an acute infarct. Okay, thus it is difficult to do, so we do not do it. We use radionuclide imaging scans, but not routinely used. So it actually does not indicate acute infarct. It indicates that there is an inducible ischemia which is occurring due to exercise. Due to exercise, there is increased demand, so there is less blood going to the uh, area supplied by that vessel. So there is induced ischemia is present. So if the patient, through radionuclide imaging, it is found that the patient has induced ischemia. So in these patients, we recommend the treatment as antiplatelets are given. In these patients, in these patients, antiplatelet therapy is given to the patient, especially aspirin is given to the patient for prevention of MI, and we also give Beta blockers can also be given to the patient. Along with, we ask the patient or we advise the patient for modification of the risk factors. Now, if there is an abnormal, so this is, then one more important thing is, if we use exercise thallium, we can also do this radionuclide imaging after exercise. In such case, we use thallium as a radionuclide, and it is called, and the sensitivity of this exercise thallium, the sensitivity of exercise thallium is almost similar to exercise echocardiography. Similarly, the sensitivity of dipyridamole thallium, the test which is used for dipyridamole thallium, the sensitivity is almost similar to um, dobutamine echocardiography.
Thank you and thank you for watching.